Hello everyone. Today we are going to learn about femur or thigh bone. It is the longest and strongest bone of the body. It can be mainly divided into three parts: an upper rounded end, a lower bicondylar end, and a long shaft. Talking about the side determination, the upper rounded end is placed upwards and the head is placed medially, which means towards the center of the body. The bicondylar end is placed downwards and the shaft is convex forwards. As you can see, convex forwards. So this is the side determination. Let's move on to the anatomical position. The head of the femur is directed medially and slightly forwards. The shaft is placed obliquely downwards and slightly medially so that the two condyles are placed in the same horizontal plane. Now let's focus on the structures present on the upper end. It has a head, a neck, greater trochanter, lesser trochanter, intertrochanteric crest, and intertrochanteric line. The head forms more than half of the sphere. It has a roughened pit or depression which is known as fovea. It articulates with the acetabulum of the hip bone and forms the ball and socket joint. The neck is 3.7 cm long and it connects the head to the shaft. The neck has two borders. The upper border is convex and horizontal and the lower border is oblique. The greater trochanter is a quadrangular prominence. It has an upper border which is interned posteriorly, known as the apex. It has three surfaces, namely anterior, lateral and medial. On the medial surface, there is a deep trochanteric fossa. Talking about the intertrochanteric line, it extends between the two trochanters anteriorly and continues with the spiral line on the posterior side. The lesser trochanter is a conical eminence and is present medially and backwards. The intertrochanteric crest lies across the bone medially and it has a rounded elevation known as the quadritubercle. Tibial surface covers the posterior and inferior surface of the condyles. It merges with the patellar surface anteriorly and the medial part of the tibial surface is longer than the lateral part. Moving on to the shaft of the femur, it is cylindrical and is narrowest at the middle. It is more expanded inferiorly than superiorly. To study the shaft, we will divide it into three parts, namely upper 1/3, middle 1/3 and lower 1/3. The middle 1/3 has three borders and three surfaces, which are anterior surface, medial surface and lateral surface, and the borders are lateral, medial and a posterior surface which is in the form of a rough ridge known as linea aspera. It has again two lips, lateral and medial. The linea aspera diverges in the upper and the lower end to form additional surface which in the upper end is known as posterior surface and in the lower end it is known as popliteal surface. The linea aspera in the upper end diverges in the form of lateral lip of gluteal tuberosity and the spiral line, and in the lower end it forms the supracondylar lines. Moving on to the angles, there are three angles in femur. First is neck shaft angle, which is formed between the long axis of the neck and the shaft. It is around 125 degrees in adults. It is less in females due to their wider pelvis and it facilitates the movement of the hip joint. Number 2 is trochanter shaft angle, which is formed between the long axis of the trochanter and the shaft. It is around 8 degrees and it is an important radiological parameter for fracture treatment. Angle of femoral torsion or anteversion. Suppose this is the lower end of the femur and this is the transverse axis of the lower end. For the transverse axis of the upper end, we take the long axis of the neck. This is the angle of anteversion or femoral torsion. Moving on, the ossification of femur occurs from one primary center and four secondary centers, out of which three are present at the upper end and one at the lower end. Out of these three, one is for head, second for greater trochanter, and third one is for lesser trochanter. The neck ossifies from the primary center, and the growing end of the femur is the lower end. The epiphyseal line passes from the adductor tubercle for the lower end, as I have told you earlier. Attachments of the shaft. Let's talk about the origin first. The vastus intermedius arises from the upper 3/4 of the anterior and the lateral surface. This is the lateral surface shown, and the vastus intermedius arises from the anterior surface like this. Below the vastus intermedius, articularis genu arises in the anterior surface. The vastus lateralis arises from the upper part of the intertrochanteric line, anterior and inferior aspect of the greater trochanter, lateral margin of the gluteal tuberosity, and upper half of the lateral lip of the linea aspera. The vastus medialis arises from the lower part of the intertrochanteric line, spiral line, medial lip of linea aspera, and medial supracondylar line. Now talking about the insertions, the gluteus maximus muscle is inserted in the gluteal tuberosity. The pectineus muscle is inserted here below the iliacus muscle. The three adductor muscles, which are the brevis, longus, and magnus, are inserted as the brevis is inserted in the upper part of the linea aspera behind the pectineus muscle. The adductor longus is inserted along the medial line of the linea aspera, and adductor magnus is inserted along the medial margin of the gluteal tuberosity. The nutrient artery of femur is located on the medial side of linea aspera and is directed downwards. It is derived from the second perforating artery, which is the branch of profunda femoris artery. The angles and curvatures of the femur are strengthened by concave side by bony buttresses. Number 1, calcal femoral, which strengthens the concavity of the neck shaft angle, and the linea aspera is also supported by another buttress. Clinical anatomy. Number 1 is avascular necrosis, which simply means cut off supply. The main supply of the head of the femur comes from the retinacular arteries, which is the branch of medial circumflex femoral artery. It is also supplied by branch of obturator artery along with ligamentum teres. During the fracture of neck, these arteries get injured, which leads to avascular necrosis. Now comes the Q angle or the quadriceps angle, which is the angle between the tendon of the quadricep muscle and the patellar ligament. It is around 15 to 20 degrees. If this angle is increased, lateral subluxation of patella may occur, which means dislocation of patella. Due to tripping or accidents, there may be fracture of shaft, which generally occurs before the age of 16 years, bucket handle tear of medial meniscus, which occurs between the age of 14 to 40 years, and Pott's fracture of leg bone, which occurs between 40 to 60 years of age. Fracture of neck of femur generally occurs over the age of 60, and it is more common in females due to osteoporosis or degeneration of calcar femoral. Thank you.